It's a beautiful day in this neighborhood, a beautiful day for a neighbor. Would you be mine? Could you be mine? It's a neighborly day in this beauty wood, a neighborly day for a beauty. Would you be mine? Could you be mine?
Hey everyone, Ben West here. Thank you again for tuning in to Wilsonville Wednesdays. Thank you for your viewership. We're here at Family Chiropractic in Wilsonville, and we're going to learn more about this small business and how they help our community. And I look forward to today's episode.
Yeah, I'm really excited. Dr. Tyler and Dr. D have some great info for us on chiropractic care and what that does for our overall health. So let's go in and visit with them and see what they have to say.
Let's check it out. Come on, guys.
Hi there. I'm Dr. Dave Dooling with Family Chiropractic in Wilsonville.
I'm Dr. Tyler Emmert.
And thank you for stopping in and spending a little bit of time with us today. This is our chiropractic office. We've been in practice over 30 years in Wilsonville, serving this fine community with chiropractic care. And I'd like to talk just briefly about what is the premise of chiropractic. And chiropractic is enjoying its 125th year in America this year. And chiropractic is always based on the premise that a misalignment in your spine can cause nerve interference. And if you have nerve interference or discommunication between the brain and the body, you're going to have some sort of breakdown or dysfunction. And so chiropractic care is focused on optimizing the function of the body and the structure, and as a result we see all sorts of improvements in health, whether it's musculoskeletal problems or other types of issues. So we have a variety of chiropractic techniques that we use between the two of us. We have 40 years of experience to serve you, and we see infants all the way to elderlies, and so we have techniques for both ends of those spectrums, as well as athletic people in the beginning.
Yeah, chiropractic is a good way to focus on whole body care. Obviously, a lot of people are entering into our clinic in pain with some sort of musculoskeletal condition, but we're able to educate through chiropractic and be able to check anything from lifestyle to health, exercise, and kind of work on people's health in all directions.
I've always had this vision for a wellness center, if you will, and so Northwest Wellness Center, we have a collection of like-minded variety of different practitioners. So we have chiropractic, we have massage, we have acupuncture, naturopath, we have counseling, we have nutrition, and then we have other type of services that maybe not necessarily health-related, but they're part of the health of the household, the health of the body. Some other services we have, cosmetic tattooist, and she doesn't do necessarily the artistic tattooing, but she helps people post-surgery that have deformities and helping them with those types of issues, as well as esthetician services as well. So a wide variety, a collection of things to help you have a better life. This is the area where we perform our adjustments, and then we have our front desk here. We're loaded up with professionals here to greet you and take care of you, and so we do a fabulous job. As a courtesy for our patients, we will always check insurance benefits, so people will have a good idea before they even enter our office if they have insurance benefits and what that will cover as far as chiropractic and massage care is concerned. So this is our adjusting area, and so we have some technology that we like to utilize. We have lots of different styles of chiropractic. Again, I've been practicing for over 32 years. Dr. Tyler's been in practice nearly 10 years. So we have almost 40 years or so of combined skills to help you, and so we do all sorts of different types of care, from injury care like car accidents and work-related injuries, to sports injuries, to folks that just have a little accident around the house, or maybe it's performance. We see a lot of athletes and people that are trying to maximize their health and wellness and create a higher sense of immunity, which is such an important time now with this COVID situation that we're all dealing with. Speaking of that, our immune function is very important and determines how susceptible we are to other pathogens that are out there, whether it's a typical cold and flu virus or COVID-19. And so things that you can do to boost your immune system have everything to do with your lifestyle. So we talk a lot about that. We have a lot of strategies. So if you're interested in learning more about that, we're here to help you with that. We also have technology where we do orthotic scanning, and that's important because your feet are the foundation of your entire body. And so this is great technology. We get to actually evaluate people when they're in a standing weight-bearing position to find out if they have any imbalances, either maybe with a leg length discrepancy or problems with their arches where they're having flat feet or they're pronating because that, of course, can affect not only the ankle, but also the knee, the hip, and up into the spine. So that's a pretty vital piece of information that we do with all of our patients that they like to know. So this is our consultation and report of findings area. So when you first have a patient with us, Dr. Tyler or myself will sit down and we'll spend a good 15-20 minutes on a detailed history with you. So we want to know everything about your past life experiences, whether you've had any accidents or injuries, and what's brought you into our office. And then from there we do a very thorough examination, which is held in the next room over here. This is our examination room, and so in our exam room we do more than just look at posture and movement and function. We have some technology that we utilize to actually measure how well a person is functioning. So we use some technology called surface EMG and thermography, so we can actually measure, do you have muscle imbalances and where and how severe, and also do you have any temperature differentials which can indicate either increased or decreased blood flow or inflammation from injury. Down the hall we have a full x-ray suite. It's completely modern digital x-rays. We have images immediately. It's very low exposure to the patient, and that information can be downloaded onto a disk and sent to your other providers, and so we provide that as well. So our examinations are very thorough. Expect to spend an hour with us on that first visit. So in our lobby area, of course, we're all about trying to educate our patients, and so it's education, education, education. We want you to fully understand how to take better care of yourself and your family, so you can reach your maximal potential for your health. And so you'll see we have a reader board that's constantly scrolling through different informative slides. We do quite a bit of nutrition, so we can help you with that, whether it's basic nutrition or you're trying to treat a condition or a problem with nutrition. We can help you with that. We talk a lot about diet as well, and things that you maybe want to eat or maybe things you don't want to eat. As an example, we have our lovely hamburger here that looks like it's fresh, but it's actually 4 years old. Bacteria won't eat it, mold won't eat it, it won't disintegrate. So that's not really food. So if you're eating those types of things, you can't expect to have full health in your body. Sweet drinks is another topic that we would talk about. And maybe you only have one soda a day, but this is the amount of sugar that you consumed in 1 month if you drink only one soda a day. So this sugar is obviously not healthy for your body.
Okay, everyone, so here at Family Chiropractic, they purchased this McDonald's hamburger and fries on September 14th, 2016. It is 196 weeks old, and it is not even moldy. It is just existing. The only things that would survive a nuclear war is a cockroach and a McDonald's hamburger, or the zombie apocalypse. Actually, if we ate this, zombies might become a reality. We might have an outbreak. So this is an idea of, this is a real live, example on what not to put into your body. So I'm not going to judge you though if you do, but just so you know, you've been warned.
So within our office, a lot of stuff we're doing after adjusting is, determining if you're in an acute or an injury state. We'll do some passive therapies to help the muscles relax, help you get out of that pain state. So we use some passive therapies like our EMS machine. So what we're doing here is we're usually applying ice or heat with this, and that is going to stimulate the muscles and block that pain pathway so that we can get the muscles to relax, get that pain under control. So usually we'll be using one of our tables in here, setting the patient up with that ice or heat in the stem. We also use low light level therapy. And what we're doing with that is we are promoting cellular production, so we can help kind of promote growth of those tissues or healing like of the ligaments or muscles. Out here we do a lot with showing different foam roller techniques. The purpose of a foam roller is kind of a deep tissue therapy to help get adhesions, break up adhesions, or help get those muscles to relax and help promote mobility when you're not in the clinic as some alternatives as well. So when you enter into the office for, let's say, your second or third visit, you'll come to the table, and every time you're in, I need to assess, we'll talk, how are you doing today symptom-wise? Have things improved, advanced, what's changed? And then from there, I just wanted to do a little assessment to see what we're feeling before we get into the adjustment. So a lot of times what that will look like is I'll be behind Kyle here, and if his neck or upper back is bothering him, then we're checking to see how those muscles are doing. We're checking movement of of joints in his spine, seeing if there's any discomfort with any of those things. And then usually from there, we're going to have Kyle go to a face down position on the table here. We'll be face down, his arms will be relaxed on the table. And he'll be checking down spine and into hips and pelvis here. A lot of things what I'm looking for is muscles that are imbalanced. They might be more tight on the right than the left. Looking to see if he's having discomfort or in areas where I'm pressing or where I'm feeling. And then I'm checking just motion through the spine.
Hey, I even found a little new amusement ride here. I don't even have to go to Disneyland. And Dr. T says I don't even have to put a quarter in, so how about that? All right.
So we have different types of adjusting techniques used here. A lot of that is a hands-on or what we call a manual technique where we're creating movement through those joints. But we also have some lighter techniques, and we'll use these for maybe somebody who has a little bit of decreased bone density, right? Or somebody who's a little bit more sensitive, or who's not ready for that initial manual adjustment if they're kind of in an acute pain phase. So one is called an activator, and it creates a little physical impulse, and so I'm able to apply different types of pressure on there and use it on various parts of the spine. And then we have an electrical form of that creates multiple impulses, where I can use that working with Kyle here. Since he's already gotten my table nice and high, I'm going to bring that down.
Oh yeah, there you go.
But I might be checking a part on his lower spine or lower part of his neck here. I'm going to head forward a little bit. I'm just applying a little pressure.
All right, so thank you for spending time and visiting us today and taking a tour of our office. If you ever want to get a hold of us, our phone number 503-682-3811.
Or feel free to check out our website at nwwellnesscenter.org.
Thank you very much. Have a great day.
So thank you so much for tuning in to Wilsonville Wednesdays again. It was a great episode this week. A lot of fun at Family Chiropractic. And next week we have a really great episode for you that we're really excited about. Don't miss it. I'll let Kyle tell you more about what he's got in planned for us.
Yeah, so we have a really trashy episode for you next week.
Ba-dun-dun.
Pun intended, dad joke, full on. I will take full credit for that.
Wow.
We are headed over to Republic Services. Jason Jordan is one of our great friends and a big supporter of Wilsonville. And he's going to show us what happens when trash gets picked up from your house. And Republic Services takes it to the site here in Wilsonville. So we're actually really excited. It's going to be a lot of fun. Kind of reminds me of Dirty Jobs, that show that
like Dirty Jobs.
So.
They have a huge facility here in Wilsonville. I don't know if everybody knows that. It's quite expansive and interesting. So we're going on a field trip. So make sure you come in and join us next week on Wilsonville Wednesdays and see where your trash goes and how it gets sorted and what happens with it, and learn more about Republic Services.
Have a great week, everybody. Enjoy the weather.
Take care, everyone.